Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, May 13th, and this is my daily briefing. We're still sitting at a total of 41 cases to date in Missoula County. 39 were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have no current cases in isolation, and we're no longer monitoring any close contacts at this time. The state of Montana has had a total of 462 cases, which is up 1 from yesterday, and there have been 16 deaths statewide. I want to start off with just a quick reminder about the mobile testing clinic that is heading to Clinton tomorrow. Just like at our main testing center at the fairgrounds, it is by appointment only. If you are a Missoula County resident or a Missoula County healthcare worker or first responder, with any COVID-19 symptoms, please be sure to call 258-INFO. That's 258-4636. Select option number 2 to make an appointment by 5 p.m. today. If you show up at the clinic without an appointment, you won't be able to get a test. So it's really important to call today to get that appointment made. As we move forward with our gradual reopening, we've gotten some questions about at what point we might consider issuing closure orders again. With this outbreak, there's not necessarily a hard and fast point that would trigger the health department to issue closures again. We do know that the disease has an incubation period of up to 14 days, so we can accurately assess the situation in 2-week increments. If we were to get more cases, we'd work with our epidemiologists and our infectious disease team to figure out what those new cases look like. One big factor that we would look at is how those cases were acquired. Did the patients travel out of state recently? Did they acquire COVID-19 from a close contact? Are they limited to a small cluster of people that we can more easily isolate from the rest of the community? Or are we unable to trace where they acquired it, which would indicate a new round of community spread? If we are able to trace and isolate cases and determine that they acquired COVID-19 through travel from a family member or from another close contact, then it is more likely that we can continue the gradual reopening process. But if we're seeing signs of community spread again, excuse me, if we start to see signs of community spread again, that's when we would need to take a really hard look at whether or not ordering certain sectors to close again would help curb the spread. Now that our testing capacity has expanded and anyone with symptoms can get tested, there's a decent chance that we will be able to identify new cases. Even though we don't have any active cases right now, chances are still high that there are undiagnosed cases in our community. And the reason that I say that is that people could be having very, very mild symptoms and not realize that it could be COVID, so they wouldn't necessarily think that they needed to go and get tested. With summer tourism season approaching, it's really important to keep in mind that visitors could also bring the virus with them as they frequent the locations we as locals also enjoy. Ideally, out-of-state visitors would follow the mandatory 14-day quarantine, but we know that there's a chance that they won't. As I mentioned yesterday, we've had multiple travel-related cases pop up in Montana over the past week. Missoula County and Montana are in a pretty good place right now, which is why we're reopening. However, we are not an island, and we need to maintain best practices to keep our community safe. No one in the community wants to get to the point where we're closing businesses again, and that's exactly why we chose to take the more gradual approach to reopening. Everyone in the community plays a really crucial role in reopening, and the more people that we have following protocols set up in stores and restaurants and adhering to social distancing and wearing cloth face coverings in places where distancing is hard, the less likely we are to see cases spike back up in Missoula County. So I just want to say thank you again to everyone who's doing their best to follow the procedures of this new normal that we now find ourselves in, and it's just really important that we continue those precautionary measures so that we don't see a spike in new cases here in Missoula County. So that's all I have for my daily briefing. It's a little bit shorter today. It's been relatively quiet, so knock on wood, we're going to try and keep it a little shorter. So as always, you can subscribe to me on YouTube under my name, Cindy Farr, that's CindyFarr. Click that little notification bell so that you get notified when we upload new videos. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website that has lots of great information as far as guidance for businesses and general information about COVID-19. That's at missoula.co/cvirus. And you can call 258-INFO or 406-258-4636 to schedule an appointment for a test at our free testing clinic. You can also call that number if you are trying to identify resources that might be available to you in the community, or if you have any general questions about COVID-19. So until tomorrow, everyone stay healthy.